Hi, my name is Wendy Adolphson, and my son has Osteogenesis Imperfecta, or brittle bones disease. That means that his bones break easily and spontaneously. On August 8th, 2018, we had our beautiful baby boy, Benjamin Robert Adolphson. A few days after his birth, we found out that he had a disabling disease called Osteogenesis Imperfecta, and that his collagen was mutated, which affected his bones, his organs, his tissue, his skin, almost everything in his body. We have since learned how to splint broken bones, how to administer pain medication, and how to care for his medically complex needs. And here are some videos showing you how to do the same. Osteogenesis imperfecta is a very painful disease, and it's a very trauma-based disease. So instead of dealing with like major health issues every single day, you might go a few months or maybe even just a week, and then all of a sudden a break will happen. Then you'll have 2 weeks or so of taking care of a broken baby or child. My son is 8 months old, so my knowledge and information that I'm giving you, that's sort of the context of it. These are the things that I use for him at his age, but I think a lot of it will follow him into his older years. So the first thing that I am going to show you is his x-ray and his binder. So on his binder, I have the immediate things that I would want to show a doctor if I went to the ER. There may be times when you have to go to the ER to have an x-ray of a broken bone to make sure that it's not displaced. If it isn't displaced, you will be prepared to splint and medicate your child at home. Some people call this a medical home. You want to make a medical home. But when you're first bringing home your child and you are unprepared and you don't have the medicine, you're going to want to start developing a binder, because you're going to run into like medical staff that don't have any idea what OI is, and they won't know how to handle your baby safely, and you're going to have to train every single person you run into, whether that be a doctor or a nurse, and even some OI doctors don't even necessarily always know how to best handle your baby. So you will be the expert. So that being said, I have infant and toddler care. It's called Handling and Care Suggestions for Infants and Toddlers with OI. I got this sheet off of the Osteogenesis Imperfecta Foundation website. Put it right on the front of the binder so that anybody who's going to touch my son, I first make them read this. Honestly, I have not actually done this very often, because a lot of the staff that I've run into just luckily have been humble enough to kind of step back and say, okay, how should I handle, or who's going to handle your son? You know, they've been open to suggestions. But if you do run into a nurse or a doctor who's a little overzealous or overconfident, and you just get the feeling that, you know, you don't feel like your son is safe in their care, then you can at least have an educational material to hand them and say, here you go, this is what you need to know before we even start anything. So I have that prepared, and the x-ray is so that I put the most recent x-ray in there so that I can show whatever doctor I'm meeting with, so that they know what they're dealing with. So that's what you want to start doing. Have all of his medical records, start putting all of his, those papers they give you, like the summary of visits when you go to the doctor, put those in here. Because if you ever apply for services, DDA, anything through the Department of Social Health and Services, or anytime you see a new doctor, it'll be nice to be organized and have all the information they need to care for your child in one spot. Okay, so that's kind of the starting point. That's something you can build as you go along. But the most important thing is to, when you bring your baby home, when you're a new mom or dad, is to be prepared to respond appropriately to their needs as soon as possible. This is a painful and traumatic disease, and so you don't want your child to be in pain for longer than they have to be. You're going to want to have some place to put your splinting material and your drugs, and I'll show you what's in here. On the OI Parents Facebook page, there are materials in the files section where you can find a dosing sheet and a protocol for how to respond to really bad breaks. Some breaks won't hurt and your child won't even show signs, and you'll later see a healing fracture on an x-ray and not even know that it was there. Some breaks only require Tylenol or ibuprofen or both. Some breaks require Tylenol, ibuprofen, oxycodone, or Lortab. If it's Lortab, then you don't need the Tylenol, and Valium or diazepam. And you are going to have to be the mom nurse that makes that decision, the executive decision of what your child needs. It's a hard balance, because if your child acts like they're hurt and you're spending time figuring out where and what is going on, a lot of time can go by, and it's really sad to think that your child is going to be in pain for a long period of time. So for me, sometimes I want to just medicate with all four, splint right away before I know for sure, just because I don't want my child to be hurting. But there's also a problem with that. You don't want to over-medicate or medicate too often, so there's a balance. But you don't want to not respond. So you really have to know your child, know their cry, have a protocol for figuring out what the best steps moving forward are. So I showed you the Tylenol and the ibuprofen. These are infant drops that I have, and infant drops and children's ibuprofen are a different concentration. So with infant drops, you're going to use a lower amount than if you had a children's Motrin. Children's Motrin is less, I think it's a lower concentration. Tylenol, I'm pretty sure they're making all Tylenol the same concentration after, a bunch of children were overdosed. But you really want to always double and triple read your labels, especially if you're in a panic mode, if your child just had a break. Read your labels, read the dose over and over again. Make sure that you're giving the right amount of the right thing. This is what the oxycodone bottle looks like. And then I have my diazepam. And they gave me 5 milligrams per 5 milliliter. He's 8 months old and 15 pounds, so he takes 1.35 milliliters of diazepam and 1.3 milliliters of oxycodone at a time. I'm not really going to go into too much detail about the dosing and how often. I'll put a link below in the description that will show you how to properly do that, or you can go to the files section of the OI Parent Facebook page, and if you're not part of that, then you should become a member. Okay, so those are the medications you're going to need. The medications are constipating, so you're probably going to want a suppository. So if your child is in pain and it's not a major break, you can get homeopathic pain relievers that are really healthy. They're not going to cause damage on the kidneys or the liver. You can give it a lot more frequently than the others. So this one is pain and fever. It's a pain and fever oral liquid from Kids Relief. This actually really works. It has Arnica montana, ferrum phosphoricum, hypericum, perforatum, thua. Okay, I'm totally butchering these, but that's what's in there. Arnica is an extremely effective pain reliever, anti-inflammatory, that a lot of people are starting to take, even with chronic pain due to injuries or whatnot. It is, our homeopathic doctor was telling us that it's for acute pain. It's not necessarily for daily chronic pain treatment, but if you did give it a lot, it wouldn't cause any issues. It wouldn't cause any damage. And then Arnica, again, can be topically applied. I have Arnica gel, so the times that I use this is if he's acting like an old fracture is sore or tweaked, I'll put it on his arm, or after the 2 weeks of healing, or however long, I'll put it wherever the break was. And it's a very effective pain reliever. I use it, my husband uses it, and even just the other day, my husband had a really, really painful abscessed tooth, and he put it on his jaw, and it took the pain away. So that's kind of, I mean, tooth pain is one of the hardest for me, because I've never broken a bone or had any traumatic pain, besides a C-section, I guess. It's pretty amazing that arnica would, I think that tooth pain is one of the worst pains, and arnica actually helps with that. So kind of along those lines, I'll just say this now. We also have oral pain relief arnica tabs that have arnica, chamomile, and some other things I can't pronounce. And these teething tabs work. They are amazing. This is not like hocus pocus voodoo medicine. This is real, true, effective stuff. This is just arnica for bumps and bruises that I'll give if I think he's sort of in pain, but I don't think it's anything major, and it actually works. When he was a tiny baby, he's still a tiny baby, but he's starting to be a big boy. When I would give this to him, he'd all of a sudden be a lot happier and would be moving his limbs a lot more. So that definitely showed me that, you know, it's not a placebo effect if it's working on a baby, because they don't know they've taken anything for pain. Just yesterday, speaking of which, he was playing with sort of a heavy toy, and his arm sort of flicked, and I could tell that he tweaked his old radius fracture that he had a few weeks ago, and he started crying in pain. And I've learned his pain cries, so I was able to go, oh crap, I hope he didn't re-break it. But I put the arnica gel on it, and as I was rubbing it, that was actually causing him pain, so I knew that that's where the pain was. But I knew it wasn't a re-break or a new break, because he was consolable like soon after that. So that's a way, speaking of which, that's a really good way to know if it's a fracture or if it's something else, is if your child is consolable, then, you know, within a timely time frame, it's probably not a break, or it's probably not a major break. When my son breaks a bone, he is inconsolable for hours unless he is splinted and with pain meds. A break is a pain that will not go away without proper treatment. So that's one way that you know. But like I said, all babies are different, and one baby might have a higher pain tolerance or a different temperament, and they may not cry as extremely as mine. My baby's pretty dramatic and expressive, and he has been since birth. Like, I mean, all babies are pretty loud and dramatic, but he's like very emotive, and I think that's part of his personality. I'm starting to find out. But luckily there is a difference between I need a diaper change, I'm hungry, I'm tired, I'm mad, I don't like where I am, I'm being held by the wrong person, I'm hot, I'm cold. He has different cries for all that stuff. And as a parent, no matter who your baby is, and, you know, no matter if they have a disease or not, you have to figure those things out. So I showed you all of the pain meds and the laxative that we keep on hand. There's another laxative besides the suppository that's called Constellos that we sometimes give Ben, and it's a stool softener. It actually brings water into the colon or the intestine, can't remember which, and that helps him go poo-poo. So those are the medications that you'll want to have on hand. Even if you don't need them right now, you're going to want to have them stocked so that you can respond immediately to the trauma, because you don't want to have nothing at home and then your child be in pain for hours as you try to figure out what's wrong, and then take them to the ER and yada yada. So you might even try asking your doctor, if you're a new parent, say, I know from my research that this is a painful disease and a break can happen at any time, spontaneously or otherwise. Would you be willing to give me a prescription of Valium and oxycodone to have on hand? And if your child has had breaks in the past or when they were born, maybe your doctor will do that for you. We didn't go to a very good children's hospital for this disease. I don't want to badmouth them too much, but they've been more traumatic than helpful for my son. And they did not prepare us. They did not give us splinting materials when we left, and they didn't give us pain medications, and I didn't know enough about the disease to ask for it. So what ended up happening was, a week, or I think it was 2 weeks after we brought our son home, he had his first break, and I was trying to breastfeed him like you would do, sort of on his side, and not only was I not educated and prepared for what could cause a break, I wasn't prepared for what a break looks like or how to respond. I'm actually very mad at the Children's Hospital for not preparing us to take our baby home. Like, they kept us there for 18 days. They had time. They could have, and even the OI doctors came and visited us on the last day, but all they said was, treat your baby like a normal baby, and he's not going to break unless he gets caught on something. Well, that's not true at all. OI is a fickle and spontaneous and unpredictable disease. It can happen in their sleep, when they sneeze. It can just happen. So for me, I think possibly he put too much weight on his arm and leg when I was trying to breastfeed him, and he started screaming bloody murder like I'd never seen a baby cry before. Well, of course, I'm in a mindset where I'm enjoying my baby, I'm enjoying being home, I want everything to be normal. I have this preset idea or perception of what it is to be a mother and be with your baby, and so I immediately assumed it was something minor. I thought he was crying so hard that his nasal passages were closing up, and so I thought maybe he was just really, really ticked off that he couldn't breathe. And so I was trying to clear his nose, and I was kind of assuming that maybe this is just his temperament. He just gets really mad and, really upset over something like that. I had to call my husband in because I was like, I can't clear his nose out. I can't stop him from crying. He's not feeling, like, I was starting to panic at that point. And my husband came out, started picking him up. We had found out that if we bounced him sort of like this, he would, a lot of times that would soothe him if it was just a minor thing bothering him. Well, we noticed that one arm was up and the other was dangling loose, not moving out of his side, and that was one thing we did know from our research online, was that if a limb stops moving, then it's most likely to break. So we were panicking, we were so sad, we were so disappointed, and we had to take him to the ER because we didn't have, like I said, the meds or the splinting material, and we didn't know what to do. And, we'd been told that he wasn't going to break unless he, caught on something or whatever, or fell, or something like that. We didn't expect it to just happen whenever, doing normal baby stuff. So, long story short, over time, I did more and more research, talked to more and more moms, I realized that with the materials that I needed and the things I needed to do to best take care of Ben and be the best mom I could be. So, moving on. What we ended up doing is from YouTube videos, learned how to splint. You're going to need Scotch cast, fiberglass splinting. Some people call this a back slab, I guess. I don't know. Amazing stuff. Hard to use by yourself. I need a second set of hands, so when my son breaks, I do end up having to call my son, or call my husband to come home. So what you would do though is, the first thing you would do is you would wrap the leg with cotton roll to protect the leg from the fiberglass splinting material, and then you would put this on, cut it to size. I'm not going to show you how to do that. I'm just showing you materials in this video, but if you do want to go from this video to actually learning how, I'll put a link in the description below to a video made by Dr. Esposito showing you how to splint either a leg or an arm. So you need this, and you need some kind of either an ace bandage. I prefer ace bandage. It's easier for me to unroll it and roll it over the limb. And you can also get this self-adhesive wrap. This is hard for me to use, but I've used it before. If it's an arm break, you're gonna want stockinettes to protect the arm. It's just really, really quick. And I actually have to I'll have to show you the other materials a little bit later when my son wakes up, because the other materials for arm splinting are in his bedroom, but he's sleeping. For an arm break, this is the way you're going to splint. You're going to splint to the body, and I have a Surgilast material that you would put over the arm. Here's the magnesium oil that I put on Ben every night or every other night. Here's the Surgilast for an arm break. This is recommendations from our homeopathic doctor, and this is an example of how to splint a leg or an arm. I hope you guys have enjoyed this video that showed you how to be prepared to respond to breaks. I know that Benjamin very much appreciates being able to have parents that love and care for him so well. And we just do. We love him so much. And we would do anything to make sure that he was happy and healthy and doing well. And we're trying to currently get all of his care situated locally to normalize his disease as well. But yeah, if you have any questions or comments about taking care of your OI child, please leave a comment below or a question. Be sure to look in the description for links and take a look at my other videos if you have questions about any other subjects. Alright, take care. Thanks for watching. Bye!